Although lockdowns are behind us, at least for now, it's become clear that we're left with the legacy of long COVID. Now, when we hear the word polio in 2024, what we think of could be called long polio. Fresh headlines came out just last month when the last man with long polio passed away after living in an iron lung for over 70 years. He was exceptionally unlucky. 96% of polio sufferers either had no symptoms at all, or they had a sore throat and a low fever, and it cleared up in a week or two. However, millions of people have been just as unlucky as he was, but with COVID. So what is long COVID? Well, the term long COVID is currently being used for a vast array of different long-term illnesses after acute COVID has cleared up. We thought this might be the case a year ago, and now we know it is. It can include a range of things, for example, viral persistence, where SARS-CoV-2 hides in people's tissues for a long period of time, or immune dysregulation. In some long COVID patients, the immune response doesn't stop after the infection has cleared. Their immune systems are continually responding. We know that COVID can damage the vagus nerve, which is an important part of our nervous system that regulates things like our heart rate and our blood pressure, and we know it can reactivate other viruses like the herpes virus. We need a better understanding of how to distinguish all these root causes, otherwise we will never know how to treat them. How many people are suffering? Well, this is a trick question because of this diversity of causes and symptoms, but all of the estimates are in the tens of millions. The prevalence, which is the number of people in our community, and the incidence, which is the number of new people who get it, are both really difficult to estimate. England has one of the best surveillance systems where their Office of National Statistics randomly surveys the public for long COVID. Now, this study is unfortunately coming to an end, but what they've learned is that the risk of long COVID drops from the second infection onwards. From the first infection risk of 4%, it declines to 2.4%. This is good and bad news. Risk drops, but not to zero. Their study showed that the number of people with long COVID is declining despite ongoing infection waves, as you can see in this graph. The long COVID dots, the squares, are not rising and falling along with the blue line of waves of COVID. Now, why should this be? Well, some scientists, including me, believe this is due to a decline in severe disease caused both by the decreasing numbers of people who are unvaccinated and decreasing numbers of people who have severe disease, because we all know that severe disease is a predictor for long COVID. We're also running out of people who aren't vaccinated, and at the start of 2023, we didn't know how much vaccines help or whether boosters have any effect on your risk of having long COVID. New information has shown us that in children, being vaccinated provides a 35% protection against probable long COVID, so judging by symptoms just after vaccination, or 42% protection against diagnosed long COVID 12 months after vaccination took place. Adults who've had booster shots are less likely to get long COVID. This is called a dose-response relationship. A 2022-23 study showed that one dose of vaccine lowers your risk of long COVID by 21%, even if you are infected. 2 doses lowers your risk by 59%, and 3 shots or more lower your risk by 73%. Today's sector expert is Houston Spencer.